I just want to explain how draconian this law is, this 2098 in the state of California. Literally would be the case that if if I was evaluating a patient, let's say you come in, you're my patient, and you come in and you say, the CDC is recommending that I get this new Omicron vaccine, this bivalent vaccine. I'm concerned because what I'm reading suggests that it was only studied on mice. And if I say anything other than standard, what would it be? Standard empty slogans as specified by the academic and the bureaucratic structure, which would be, you're over 60 years old, it's recommended that you get this booster. If I said,
follow the proto.
If I said, for instance, you're right, it was studied on mice. I'm probably going to recommend it to my patients over 65, certainly over 75. I think it's worth the risk. There is antecedent, very, very similar vaccines in influenza. And this is sort of how we do it with influenza every year. We don't test it necessarily in humans every year. So there's a protocol out there. But if you were 30 years old, I would say, there was just a study that came out in Circulation this week that suggested that in men under 40, the risk of myocarditis is 5 times higher from the Moderna vaccine than from COVID itself. Right there, that would qualify as misinformation, even though it's factually accurate. It's merely me discussing what's available in the medical literature with my patient. Let's say that patient was angry for some reason. That patient could make an anonymous complaint to the state. And he or she could go home and go, you know what, mom and dad and brother and sister, you guys, I'd like you to make the complaint too. Here's what my complaint is. Why don't you modify a little bit? I heard something you said in the public the other day I didn't like either. So add that to it. Each one of those complaints would be dealt with as though a police report had been filed for a criminal action. It will require a full response with citations and will take months and months and may require hiring an attorney for each case. That is what they are doing. It is absolutely out of control. Now, I'm sure they're going to say, oh, no, would never use it like that. Of course they don't intend it. That's how these laws have unintended effect. It will be absolutely chilling on the practice of medicine. It'll become almost impossible to practice medicine the way we are trained to, which is to use our objective reasoning, to share our ideas with our patients, and to come up with the best possible recommendation for that particular patient for that particular circumstance. So I'm gravely, gravely concerned about that. So back to AB 2098. This is a bill by a pediatrician whom I had pushed forward some other vaccine bills that I was sort of in favor of. And now I feel like he has gotten over his skis and gone too far. He is essentially saying that misinformation, and they're saying specifically about COVID. I don't know if you're aware, but there is a lot of misinformation in medicine out there all over the place. There are people that are not qualified to make some of the sweeping declarations that they do. And there are people that are qualified and still say things that are outrageous. So we have a full spectrum of very a lot of misinformation flying around when it comes to healthcare. And we've always taken the position in this country that was just sort of part of being in a free society and, caveat emptor. I've seen physicians who were actively psychotic practicing medicine. And of course, there are people that have no business saying some of the things that they say because they literally don't have the training or the funded knowledge to say it. And yet we allow that to happen, but to allow physicians to question orthodoxy publicly, particularly when orthodoxy is based on a bureaucratic sort of infrastructure, that is a problem. That to me is a really bad problem. When you look at the history of medicine, it has always been the scientists and the physicians that have sort of brought up question marks, not have gone into outer space with hubristic, assailing of the current orthodoxy, but people have said, I don't get this. I don't see it. Let's talk about this some more. Perhaps this isn't necessarily the right way to go. And it literally would be impossible to do that, certainly publicly. And I just know how the Board of Medical Quality Assurance works in this state. And anybody can say anything anonymously or on the record, and it is dealt with as though it is a police report filed by a police investigator in a crime event. And literally, you have to respond in writing. You have to provide documentation. You have to put references for your position back. And so let's take, I think I mentioned this once before. Let's say you're 20-year-old son comes into my office and we start talking about, is vaccine a good or a bad idea? So we have this Omicron vaccine now. It's only been tested on mice. Generally, what I would tell somebody like that is, we really know what we're doing with people over 65, certainly over age 75, where the risk reward is clearly worth it, even though this vaccine was just developed on mice. This is a very similar paradigm to what we do with the flu vaccine, and it works very nicely. So I'm going to guess this is worth the risk for a 75-year-old who really can have bad complications from Omicron. We've known forever that people younger really don't have a lot of risk with this thing. Not to say that they never get into trouble, but to say the risk is extremely low. So the question then is, could the vaccine risk be higher than the risk of the COVID itself? Well, we have a circulation article out now that showed a 5-time greater risk of myocarditis from the vaccine as compared with the COVID itself. People have assailed that study. I think it's a pretty good study. All these studies are worthy of being deconstructed and examined very carefully. But I'm going to hang my hat on this one a little bit and say, I'm going to worry about that, even though the incidence is very, very low, very, very low. If that 20-year-old said, you know what, I want to go to, some country that requires a vaccine, and I'm not worried about it. And by the way, I had the Pfizer, and it really didn't bother me. I'd go, okay, all right. I worry about Moderna because that was one that had all the myocarditis. I wonder if there's a world in which we can give lower doses to some of these younger people, but no one has done those studies yet. But Pfizer is lower dose, so okay, why don't we do the Pfizer Omicron if that's what you want to do? But if you're concerned about it, it's a rational position to say, I'd rather get the Omicron probably. And by the way, probably already been exposed to it. And there are not a lot of good ways of testing for that to see whether you have the neutralizing antibodies for it yet. Now, that conversation, if that patient, the 20-year-old, got angry for some reason and went out to the Board of Medical Quality Assurance and just made a complaint because I discussed misinformation with him, and he could easily go to his friends and go, would you mind making a complaint to also, here's what he did. Literally, you can make as many complaints as you want, many people as they want, and each of those will be dealt with as a criminal action. Not criminal in the sense that it'll go to criminal case, but criminal in the way the due process plays out. It requires a similar kind of defense, and it may require hiring attorneys for each one. I'm going to tell you something. Doctors froze in the early part of COVID. That's why we got so much crappy care. People weren't trying to follow up and find ways to manage this illness. They just froze and were scared because they were in an employment structure that said, just send them home. They did the same thing with the opioid epidemic. I was there as it happened. There were a couple of cases of both criminal and civil action against physicians for under treatment of pain. Physicians froze, stopped treating pain, stopped prescribing opiates, sent everybody with pain to the pain specialist, and the pain specialist took the position that pain is whatever the patient says it is, and pain control is whatever the patient says it is, and now it was on. That's how the opioid crisis happened, or it's still happening to this day. The CDC states that COVID-19 vaccines are safe, effective, and reduce the risks of COVID-19. Always consult with your personal physician before making any decision about your health.